So thanks again for joining. We're gonna go ahead and get started. We have a good amount of audience so far. So the first part, we're gonna talk about what to do from now till you start your intern year. The number one advice is that enjoy your time. The residency itself is physically and mentally overwhelming. It's very important to try to take some at least 1 to 2 weeks, whether it's a vacation, enjoying time with friends, family, playing like a lot of sports, because the time flexibility later won't be available. So that's my number one advice, especially for the 1 to 2 weeks before starting. Some of you in certain programs, there are some orientation weeks, whether it's 1 week of modules, events, onboarding process. That's also best good time to get to connect with your colleagues who's going to work with you in your intern year. So take advantage of any networking connection opportunity because you want to build friends along your residency whom you can vent with, who can support you during if you have a rough rotation. So that's the best way to maintain not only long-term friendship but also support during your intern year residency. For those who are yet to take their USMLE Step 3, I always say it's never a bad idea to start preparing for it. As you start intern year, it's usually the first 3 to 6 months, it's busy. You're trying to learn a new system, new culture, getting to know your attendings, getting to know your colleagues. And then on the side, you're trying to think when I can do the prepare for the USMLE Step 3, and it can be difficult. And most of my colleagues who did not get the step 3 done before residency usually couldn't do it till the end of first year or even in the middle of second year because they you can't have the flexibility of the time to do the UWorld question banks and others. So if you have already been preparing for that step 3 and you think you're ready for the exam, it's not a bad idea to try to complete it before your residency. If not, maybe at least try to come up with a plan from now. If you're gonna do some 1 to 2 weeks of question banks and prepare your resources, so at least you'll have a week break, start your residency, but some time during your intern year, you'll be able to finish the UWorld questions and take your step 3 because that will get a lot of pressure off your shoulders. So that's my second advice. Now, moving into the general tips of how to master your intern year and residency overall. I think one is setting up your goals for each semester. So I usually like to divide residency into 6 semesters. Most of you are in the 3 years, unless you're like med peds, it might be 4 years. But try to tell yourself, what do I want to achieve in by December, and then later on by June. This should balance two things. It should balance one, your internal medicine residency performance, as simple as I want to master how to pre-round, write notes. Could be a very simple, take 6 months, trust me, to do that. And next 6 months might be I want to come up with a full assessment plan for all the problems myself and try to independently manage a patient without needing help from my senior resident or my attending. So these are the kinds of goals you can set for your residency. Another, you know, goals you have to set, if especially if you have interest in fellowship, how can I prepare that upcoming fellowship application? For those of you who are, I bet most of you mentioned internal medicine, if you have an eye on any sub-fellowship, for me, I was interested in gastroenterology. And I know that the application is usually due at the end of the second year. And then if you imagine the first year, flies quickly, then you're gonna barely have a year to build your application. And it's similar to the residency application you guys did, which involves research, letters of recommendation, and personal statement and others. So it would be helpful to keep in the back of your mind if you have an interest in fellowship, what should I do each semester? Usually, as simple as writing a case report is the best thing to do in the first half of the year. Connecting with a mentor, asking other residents at your institution who are either applying or matched into that fellowship about advice, who are the best mentors to work with, who are those who can help us with research and are productive at research, because most of those fellowships are going to be requiring research publications. So that's something you could set. So you have to keep doing that for the 3 years of your residency. The goals could change. You could achieve something way faster. You could achieve something way slower. So some would think, oh, I can easily master being a competent resident within 6 months. You'll be surprised. It might take you 2 years to feel you can independently manage a patient with minimal supervision. So that's the number one advice in general about how to, be well organized in your residency and intern year. Second advice is building a good reputation. It's, people don't think that they talk behind your ears or even at the level of the program leadership that people don't review the performance of and evaluation of each other. They do, and their reputation matters. So in general, try to never be late, never cut corners or be lazy, or never be dishonest. It's very common and normal to say, I don't know, sorry, I forgot to check this, sorry, I forgot to do this. And it's always easy to look things up again in the middle of the round or do it again at the right way. It's detrimental to claim you something you don't know or to claim that you did something when you did not. And once you break your reputation, even if it is once, it's gonna take forever to build it again. So always be hardworking. Don't cut corners, and then be transparent with everyone you work with, and always be professional and respectful with others. There are many personalities, and I bet you guys have friends or you've worked already, whether you had research experience, observership, and you've noticed the different personalities you might encounter. Some are very, friendly, professional, easy to work with. Other might be stubborn, might be picky, and sometimes can be rude to you, whether, they've been exhausted at the end of their shift and they're talking to you about the consult and they're not giving you the best attitude. Stay professional, stay respectful. This is actually even most important towards the end of your intern year, because that's where burnout is common. And the first sign of burnout I usually notice is when my intern is, venting over a phone with another colleague or venting about the nurse or, oh, sometimes you can get yourself into trouble. I've seen that where someone really regret the comment he or she made and later on had to be called to the program director office for something bad they said, even though they're very good, intern, but that, inappropriate comment got to them. So try to be professional, respectful for everyone, and then be collegial and avoid any confrontation. Even when something is not, appropriate, maybe, stay professional. Sometimes I usually like if there's very, very inappropriate comment, I would just sorry, like I feel like we're not getting moving forward this conversation. Maybe it's better for my senior resident to talk to you or my attending to talk to your attending directly, and then apologize and hang the phone. Have escalate the level of communication. It will always help because attendings are usually the friendliest with each other, and then it ends up being on you interns because they'll say, "Oh my God, no, I don't know these interns. Why did they, fight about this when because we figured it out in 2 minutes over the phone?" And then they'll be like even laughing over the phone and realize, "Oh my God, I was about to start a war with the intern on the other service on surgery, for example, and then these attendings are chit-chatting and laughing about it." So that's why I don't get into a fight with anyone. And if you have any, conflict, escalate. So, third general advice, always be curious and ask and try to answer questions yourself. So, understand what you're doing. Sometimes you're very busy trying to just complete the task you've been given or write notes that you forget to understand what you're doing, like for the patient. What the assessment and plan is all about. So try even when you're like super busy trying at the end of the day to type the note, to summarize the plan of care for this patient, to understand what you're doing. I can tell you for sure that was the first month half of what you're writing, you're not going to understand. Because it's something that the senior resident or the attending told you to do. And it's like, why did they choose this antibiotic? I don't know why they want to get this echo again. And I don't know why they chose this medication on instead of this other medication. And why they said this patient is not safe to be discharged and we're concerned about this. You might be typing that in your note. If you want to stay at that, usual average level, you just write it and hope that over 2 years you'll learn it. But if you want to actually really have a steep learning curve, try to understand what you're writing and convince yourself that actually it does make sense that we chose this medication instead of that other one. Because when I reviewed more, like what I read about this, or I asked a good question to my senior resident, the picture made sense and the puzzle got connected well. Another thing is don't ask too much. So that's the other, two-edged sword of this. If you're like the person who will be asking 100 questions about each patient, even simple questions that can be easily looked up, that will look bad. So I usually like for my interns that they ask me about the dose of the medication. It's like, what? How much should I give him from vancomycin or cefepime? I was like, did you look it up? So the first step is try to look up things. You have up to date. You have many resources. Even if you have dosage issues, you can always call a pharmacist. There's a number for each hospital. They have an inpatient pharmacist you can talk to. So always try to show that you try a step or two to get the answer. But then when you hit really a dead end, that's when you try to ask. But if you're always in the position of asking, 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 you'll never learn as good as when you're actually investigating it yourself. Because if you open up to date and read about this medication once and you realize, oh, so if the patient is on dialysis, this is the right dose. Otherwise, it's this is the recommended dose. Doing it once or twice, you'll memorize all the doses for the medication. So when you're actually even admitting a patient as a second year resident, you don't need to check this again. You know this because you've searched it yourself and you've seen that page and up to date. And similarly, I tell others if it's not a busy day and you're finishing early, try to pick a patient and then open up a summary paragraph from up to date about. Is it the heart failure guideline directed medical therapy? Like the beta blockers, ACE, ARBs, ARNIs, other medication. I'm gonna go through the list. But if you have a patient with heart failure and trying to realize what were the medications I need to make sure the patient is on, you open up that up to date. They have the summary tab where it's like just barely half a page that would summarize the heart failure and treat medications. Just read it. If you choose one patient each day, it's a light rotation or a light day, you'll learn a lot over the year without you even knowing. So, and this it will get you along, and then you'll be way more competent senior resident starting your second year when you're gonna be asked to supervise interns, or sometimes some programs, Baylor was like that, where you admit on your own overnight. You have a support of an attending on call if needed, but you'll be admitting 8 patients solo and managing them. So if you already done, quite a bit of reading, you might, not need to even call the hospitalist anytime. I don't say that you should not. If you always have question, always bring it up. But try to be independent, curious, and that's how you build yourself as a clinician. Because the residency is the 3 years to build your entire career. So if you just try to pass through it with minimal effort, you're gonna regret it. Like even at now as a GI fellow, and I look back and even when I see a patient who has not only a GI issue but another medical issue, whether it's renal, rheumatologic, endocrine, whatever, feel glad that I invested time on those clinics, on those rotations, even though I know I'm not gonna go into room, I'm not gonna go into nephrology, I'm going to GI, but it will make you a better clinician for the rest of your career. There is no way back into residency once you graduate. And many will come to this at the end of residency when they realize when they're finding their hospitalist job, primary care job, and then, oh, damn, I don't know if I'm going to do this on my own. Who am I going to call if I don't know what's going on? And it might be too late. So absorb as much knowledge, take advantage of every learning opportunity. That can be not only patient care, this can be conferences, morning reports. Try to engage in those. Even though you might not be the best at discussing a morning report case, give the effort. You could be frustrated the first month or two when you don't understand what they're even discussing about in this case. But if you slowly keep investing your effort to, share your assessment and you slowly sharpen it and improve it, you'll improve your clinical reasoning as a physician. So take advantage of your 3 years of residency. It will last you forever. Another advice is don't compare yourself to others. I see that a lot where it's like, oh my God, the other intern is amazing, is already on top of all those assessment plans. Even the senior is bragging about this intern, and I feel like I'm still trying to survive how to prescribe Tylenol or how to, whether I can give Tylenol safely to this patient or not. The answer is 99.9 yes, so give Tylenol. But it will be frustrating to you. The way I think you always have to look one step up, one step down. Like that's the only healthy way I used to think about it. So look some one step higher to see like there is something you could do better. Why is this person better than me? For example, they might be doing something extra, and then you look to try to improve. At the same time, it's good to look at someone who's a bit underperforming than you, and then compares like, okay, I'm at least, better, and I have something to improve. That usually is the way. I don't know if this is the healthiest, but this is the way to, you know, keep yourself satisfied with your performance, but also have a goal to continuously improve. But don't keep an eye always high up on the best performing person, and then you'll be super frustrated. Although you're learning, and people don't feel it. Interns always think I don't know anything. I was like, I didn't learn anything. I don't know. I'm like here for 9 months. I'm just typing notes and checking boxes and doing the task you're telling me. And now you're gonna tell me in 3 months I'm gonna be a senior resident on my own. There is no way I can do this. You're learning even when you don't know it. Just trust the system. You realize that when you start as a senior, when your interns are starting and they don't know anything. So you'll realize looking back, like, oh my God, I know a lot. So I did definitely pick up things. So trust the system and it will teach you things. Two more general advices, and then we can take questions. Don't take shortcuts in patient care. I usually think like treat every patient as if they're a family member, a friend, and don't try to take shortcuts, for example, on the end of the day, on a weekend when you have an event trying to make to. It's unfortunately common for some people to, oh, it's a weekend, the sign out is early. I'm trying to go grab lunch with friends or dinner, and I have this patient who's a bit sick. Yeah, let's just like, stabilize, however, and then sign out and get to that event. We'll come back to the first point I mentioned, is the reputation. This will ruin your reputation. If you're like a lazy person who will cut corners, this will look bad on you. And it's also not bad for the patient. Someone else will take care of that patient if something bad happens overnight. That's why there's night float system. But you're not doing justice to your colleague. You're not doing justice to the patient. Because imagine your family member is being admitted and someone is doing exactly the same as you did to them. You're not gonna feel happy about it, and you're likely gonna be, complaining and making problems. So don't do that to any patient you take care of. Last advice I want to emphasize is wellness. If you remember when I started, it's like enjoy your time before starting the intern year and then take a week break because it's mentally and physically overwhelming. It is. The best thing to keep you well during these 3 years. One, maintaining good number of friends. Some of them should be from your class because there's nothing better than venting about things you had to deal with at the end of the rotation or at the end of a week. You guys meet on a weekly basis and then try to maintain a healthy exercise, whether it is even once a week, twice a week, whether you go play tennis, you go to the gym at the twice a week, try to maintain some form of exercise to just relieve your stress. Healthy eating habits is important. It's very easy in the intern year to start. Oh, I was like, I'm either you have two options. Those are the stress eaters and the stress starvers. Whether Like you realize an intern had did not snack or eat anything for the entire, didn't even drink water, and the kidneys are dying. And then you have the others like just, I don't know, just snacking out of stress. So try to either have like planned meals with you at work, whether that these are healthy snacks, hydration. I usually ask interns to either bring their own water bottle, like to drink it by the entire day, because the shift can be up to 12 hours sometimes to 14 hours. And then if you're working for 12, 14 hours without eating anything, without hydrating, and you're coming back home and you all of a sudden you have to, eat and drink to, and then go to bed and wake up to it another day, it's very stressful on your body and it's not healthy at all. So try to think about that as well. Your senior resident should and attending should also, in an ideal case, keep an eye on these things, but it might not be the case everywhere. Because remember, the senior resident sometimes might be stressful themselves with trying to survive as a senior resident, supervising a big list with, two, three interns. So it's not always, chill. They might be comfortable supervising interns and making sure they're not only doing clinically well, but staying well as well, physically and mentally.